It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is the first time you've tuned into our show is about how an older adult can live a healthier, happier life. And how do they do that? They do that by listening to the show. And it's not about me. It's about these incredible guests that I've been bringing to you, our audience, for the last 9 years. So today is no different. I am really proud to have in the studio. I have got with me Pam Foster. She is the Vice President of Care Coordination for Honor Health. And for those that don't know this, Honor Health is a major healthcare provider here in the Phoenix metropolitan market. And I am very pleased to have Pam, who is a friend and is so instrumental in the work that is being done here in our community, especially in care coordination, transitionary care, and really the well-being of folks that live in our community right here in the Phoenix metro area. Welcome to the show.
Thank you, Bob. It's a pleasure to be here today.
Well, it's good to have you too. And, you know, speaking of Honor Health, my father, who has been here on the show before, affectionately known as Noodles. He, as I shared last Friday, was in the hospital, one of your hospitals, up there at Thompson Peak, and he had a heart attack and successfully had a couple stents put in, and on Saturday he was discharged home.
That's great.
So it's so good to have him home, and I got to tell you, exceptional care.
Yeah.
Really, really exceptional. He'd been to Thompson Peak before, but never was actually there. He's been at the other hospitals a lot, but Thompson Peak, he's been in the ER and then been, released. But he was admitted there, and Pam, I'm telling you, the care that he received and the care coordination he received was exceptional.
Oh, that's great to hear, Bob. I'm so glad.
Well, big shout out to Noodles. So that he continues down this path, and he gains his strength and his health, and is here around for many, many years to come.
Yes, certainly hope so. Yes.
So Pam, I love having you here on the show, and I can't believe I've been on for 9 years and I've never had you on.
Oh, well, thank you, Bob. It's great to be here with you.
Well, for our listeners, I would love for you to share a little bit about yourself, because when I first met you, I didn't realize the path that you had, and you have worked with a number of healthcare institutions here before you joined the Honor Health team. So if you would indulge me and our audience, can you share a little bit with us?
I would be happy to. So I have been in the healthcare industry for over 30 years. It pains me a little bit to say that, but it's true. I started out over at Sun Health, which is now Banner, but over in the Sun City. So worked with
Lee Peterson?
With Lee Peterson.
Lee.
Yes. He was my first CEO. Yes, worked there for almost 20 years in total. So love the community of Sun City and Sun City West, and really watched it grow it's just, I can't believe the growth today.
And when you think of Sun City, you think of the vision that Del Webb had.
Right.
Isn't it amazing?
Yes, absolutely. And, Del Webb had the first, really in the area, the first behavioral health or mental health program. He was very committed, and we had a wonderful unit over at Del Webb. It's still there. They do amazing work. So he was really, truly a visionary, but loved the community, loved working with older adults. And about 15 years ago, transitioned over to the Mayo Clinic, and I was at the Mayo Clinic in Arizona for 3 years, and then doing care coordination and sort of similar role, and then transferred up to the Mayo Clinic in the Midwest and worked up there for several years before coming to Honor Health.
So you moved to Minnesota?
Wisconsin, actually.
Oh, you went to Wisconsin?
Northwest Wisconsin,
okay.
Yes, but I was in Minnesota a lot. That's why I'm back in Scottsdale.
And when you came back here, you came back to Honor Health?
I did, yes. Came back to Honor Health and transitioned. And so I've been at Honor Health now for just about 7 years.
Wow. Well,
It's been a privilege, really. It's wonderful.
Well, it's a privilege to know you because I know the work that you do is so important. And you talk about care coordination, and that's why I shared at the top of our show, how important it is when you think about all the moving parts and all the people that are involved. And, with my dad, whether it be anesthesiologist, whether it be surgeon, whether it be nursing, and then obviously discharge. I mean, there's just a lot of moving parts, and, you have a big job.
I do. We do have a big job. Yes, there are a lot of moving parts, Bob, and it's, it really is when you think about it, about all the things that have to go into coordinating someone's care plan or their transition home, or, there's a lot of things. And unfortunately, when people come into the hospital, whether it's planned or unplanned, it can be a life-changing event, right? And so we have to think about, what is this patient going to be able to do at home? What kind of support do they need? And it's not just in the coming days after the hospital, but we really have to think beyond that. And what is this going to look like for the next, sometimes several months? Sometimes people have, life-altering changes after a hospital stay. So really, our role is to help them plan for that, help them, mitigate any potential complications that can occur after a hospital stay, and really put the right supports in place. And we know that most adults, nearly everybody wants to age in place at home, and they want the support at home so that they can recover. And we know the best outcomes are in the home, and people are more comfortable, they're happier at home. So we really do everything we can to help our patients to succeed in their own homes.
And knowing you like I do, when somebody gets admitted, those conversations happen almost right from the start.
Yes, they do. That's right.
Even if somebody's there for 10 days, you're already starting to talk to that patient and their family on how do we get them back home.
Exactly, right. And sometimes that can be a little daunting for people because they're like, gosh, I'm not ready to go home yet. And and we often know that, but you're right. We do have to start those conversations very early in the stay because with different insurance companies and just different factors that we have to work with, it can take several days to make arrangements. And so we like to know, we like to kind of start that planning process very early. And, there's a lot of disciplines involved in that planning process. There's the physician, there's, often physical therapy or occupational therapy, there's case management and social work, nursing, sometimes dietitians, respiratory therapists, pharmacists. There's a whole team of people that work on that plan to get someone safely home.
A lot of moving parts.
A lot of moving parts.
A lot of moving parts. And, there are a couple things that, we have drawn a lot of awareness to. I mean, first and foremost, we know statistically about 1/3 of our population, because this show is about how older adults can live a healthier, happier life. And 1/3 of those older adults, 65 and older, are living home alone. And that makes it even a little bit more complex. And then you add to the fact that the social determinants of health, and that's something, we're great at acronyms, right? SDOH, that is something that hospitals and post-acute providers are always very cognizant of.
Oh, yes, for sure. And, I like to say, I'm a social worker by trade, so I like to say I was into social determinants before it was popular. but it's something that social workers have always been passionate about. And we've always known that, when there's a gap in food availability or healthy food availability or transportation or safety or, being able to get your utilities, that you're going to have a harder time managing your health unless those needs are met first. So that's something we always work toward, is closing the gaps around those issues.
Right. And I know everybody wants to go home. And, this may be kind of teeing up our second segment as we wind down this first one. And we know that that's where they want to be. And if they can be safe, how do we get them there? And certainly one of the things that I'm very privileged to be in a partnership with Honor Health is, you have this foundation. And, the thing is that Honor Health is obviously a conglomeration of the old Scottsdale Memorial, then became Scottsdale Healthcare, and John C. Lincoln, both which were community hospitals, and really both had incredible foundations that supported the community. And And you, meaning Honor Health, the coming together of them still do a lot of that and really utilize that foundation to help the community as a whole. So
We sure do.
and you know what, when we get to the second segment, we'll talk a little bit about some of the things that you guys are doing.
Great.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Pam Foster here in the studio with me. Pam is the Vice President of Care Coordination, Honor Health. Stick around. 1 down, 3 more to go. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Pam Foster here in the studio with me. She is the Vice President of Care Coordination for Honor Health. And if you missed that first segment, you want to go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. And if you missed our first segment, we talked a lot about the work that Pam is doing and the great work that Honor Health is doing. And speaking of care coordination, when we left off in the end of the first segment, we talked about those patients that are being discharged. And we talked a lot about the foundations. Foundations from John C. Lincoln and Scottsdale Healthcare, which now make up Honor Health, and how supportive they are of the community. And, Pam, I want to, have you just share with our listeners, I know, some of the work that you're doing, especially with those that are, dealing with social determinants of health, and finances are really, really difficult. And making a discharge to somebody who really wants to go home, and the staff, the case management staff, and maybe the nursing staff at Honor Health is unsure whether they can make that transition.
Mm-hmm. Yes, absolutely. And so that's something we're always assessing, Bob. And there's a lot of, there's a lot, as you said, there's a lot of moving parts around that. And, the first thing we really have to do is assess what will be needed, what kind of services will be needed, what is the patient really able to do for themselves, what are they going to need help with. And there's a whole host of things. We look at food insecurity. Does the patient have access to food? Are they able to prepare food? Is it healthy food? What kind of medical services are they going to need when they discharge? Can they get back to the doctor? Do they have transportation? All those types of things. And then there's just the ability to be able to take care of yourself, to do what we call activities of daily living. So
Right.
Bathing, grooming, dressing, those basic things that we all take for granted oftentimes. So those types of assessments are happening in the hospital all the time. And then we try and link the patient to the appropriate services. So there are, we're here in the Phoenix, Scottsdale metropolitan area. We are very fortunate to have a lot of great services where, care can be provided in the home. And sometimes that's covered by the patient's insurance. So that's something that we're working towards determining and trying to coordinate through the patient's insurance to get as much of that care covered as possible. Sometimes the care is really, more of what we call a custodial nature, or meaning that the patient will have to pay privately.
Mm-hmm.
And so some patients and families are able to do that, and others are not. So when we find patients who have gaps, we try and close those gaps the best we can. And as you mentioned, Honor Health has a wonderful foundation. So we have, grants and funds, and we're very blessed at Honor Health to have the Desert Mission. We have our own food bank. We have lots of services. We work with Circle the City. We have a lot of partnerships with community-based organizations who provide care and services to patients at home. So we work to, link all those services together and really try and come up with the most comprehensive plan that we can, so that the patient will be safe and cared for, and not have to return to the hospital. That's our goal.
And it's interesting. It's not, diagnose, handle, or do whatever they need to do with adios. And I mean this because, I'm my father's appointed person. I have his power of attorney, and I'm his plus one, if you would. Monday morning, around 10 o'clock, I got a phone call from an Honor Health nurse checking in, saying, hey, how's your dad doing? You know, is there anything you need? Did you go through the discharge orders? Is there anything I can help you with? I mean, those are the types of things where, you know, I really appreciate, because I get a chance to see that firsthand with my own family member, but I know that's happening to everybody in the community.
Yes, it is, Bob. And we follow up. We make a tremendous effort to follow up with every patient who leaves our facility within 24 hours to make sure that they're doing okay. And we've got a lot of measures that we can use to close any gaps. So if a patient, you know, is having a problem with getting a prescription filled after discharge, we have a pharmacy team that can help close that gap. If a patient is actually having, you know, some kind of a clinical issue, we can often send a nurse to the patient or facilitate getting the patient seen in one of our facilities. So we really, you know, have a lot of options for the patient, and so that they don't have to come back to the emergency room. That's really the last place we want them to come after they've had a hospital stay, unless they really need to be at that level of care. But most of the time, we can usually provide care at another level that's safer. And again, you know, if we can do that in the patient's home, it's always the best place to provide that.
Absolutely. And let's face it, I mean, you know, since the Affordable Care Act, there's incentives for providers like Honor Health to prevent readmission, and they're de-incentives too.
That's right.
And you don't want them coming back.
No, we get penalties. Right, that's right. We get penalties if patients come back to the hospital after discharging, and so, you know, we really are on this what we call you know, the value-based journey.
Right.
And so it's really about creating value for patients, and, you know, we want them to have a good experience while they're in the hospital, or really dealing with any healthcare provider. We want the best quality outcomes, and we want to do that at the lowest possible cost. So that's what's called the triple aim, and that's been around for a while now. And so hospitals, you know, the Center for Medicare and Medicaid Services really told hospitals many years ago, these are the three areas that you're going to have to excel in if you're going to succeed into the future. And so those are the things we've been working on for a long time now.
You know, about 6 months ago, I had the pleasure of having Todd Laporte here on the studio with me.
Oh, that's wonderful.
And I remember meeting Todd literally like 10 years ago, 11 years ago. And Todd, as you probably know, he's really good at drawing things backwards. Because I was in on the other side of the desk, and, you know, he was explaining to me how CMS was going to pay Honor Health more money to keep less people in the hospital. And I was like, really? That just doesn't make sense. But when he explained it to me, you know, you talk about value-based, it makes all the sense in the world.
Right.
It really does.
Right.
So it incentivizes the institution to do right by the patient. And it's not by, you know, churning out all this money. It's about churning out patient care and making it the proverbial win-win.
Absolutely. And it's really forced us to look at care coordination through a whole different lens. And it's something that I know Honor Health and all healthcare institutions in our country, it's something that we talk about all the time, and we really work on. And it takes a very concentrated, focused effort to provide well thought out, coordinated care. It's, you know, the healthcare institutions are very, very complex. And, you know, just when you think about it, just to get a patient's medication profile correct from the time they come in to the time they leave is a very, very complex process. And it's something we're constantly working on. And so, you know, we love to engage with patients around that process, because, you know, the patient owning that and, you know, being responsible for that is one of the best things you can do for a safe hospital stay and a safe discharge.
You know, talk about pharmacy. So Dad's doctor, Noodles, I'm talking about you. So if you're listening to the show,
Hi, Noodles.
Dad's surgeon prescribed a brand new anticoagulant, and I can't remember the name. Begins with a B, but he's no longer on Plavix, and it's a very expensive drug. Mm-hmm. And the beautiful thing about Honor Health is they gave him a coupon. Mm-hmm. They said, here's a coupon to help you get started on this thing, and And then, he's going to go from there. And obviously, it's the Part D of Medicare and all that other stuff that comes along with it. But I love that fact that, look, the pharmacy was realizing that this was a little pricey, and he didn't ask for the coupon, but they gave him the coupon for that.
Yeah. We really try to make sure that, patients have access to medications. And sometimes, depending on the insurance, they have formularies that they have to follow. And so we really work to coordinate that. Or if it's one of these expensive medications, we try to get the prior authorization before they ever leave the hospital so that, when the patient gets to the pharmacy, they won't have a problem. But even with all of our best efforts, sometimes patients get to the pharmacy and there's a problem. So, that's why we have a wonderful line where patients can call in after they've been discharged to get help through all of that. And so we try to rectify that, very quickly. And I had a family member in the hospital last fall and had to use that service for her. And it was wonderful. I mean, I have to say, it was just something that I thought I was so thankful for. And I thought, what a wonderful service to our patients. And so, nobody wants to be, wants to be frustrated or to be running into barriers, especially when you don't feel well. And so to have those services and that sort of safety net is really critical to the health and well-being of our community.
So true. So true. And, we talk about the discharge and what goes into that. And I want to get back to that, but just ending on pharmacy. I mean, we talk about moving parts. Dad's on like 30 different medications. And, when you got people adding medications to it, it's so important to have experts looking at that because obviously the drug interactions are so important to know.
It's critical.
Because, one it could be fatal.
It could be, yes,
but
absolutely.
And he came back with a new list of drugs. And, and I asked, so why isn't this one on? Well, it's not on because of its interaction with this drug. So it's really nice to know that. I want to close this segment and just talk about the fact that, look, one of the things I love about the partnership I have with Honor Health is the fact that we as a entity are able to go into the patient's home. And, that's something that Honor Health isn't able to do. And that is why you have partnerships like ours, as well as with other providers, is that you're able to utilize these resources to get a lens on the home because sometimes the home is the reason why they're there.
That's right.
And,
yes,
that's
right.
And it's really hard. Sometimes we're going in on behalf of our partnership to take a look at the home, and we're calling back your team and saying, you know what, it's not safe for them to discharge home.
Right, and that's right.
And that's really important. One, for a lot of the things that we talked about, obviously value-based, and you want to make sure that you don't have that person return for readmission, but it gives you and your team an opportunity to find, okay, they can't go home, where do they go next?
Exactly.
Well, you're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Pam Foster here in the studio. She's the Vice President of Care Coordination for Honor Health. So good to have you here in the studio. Again, I can't believe it's been 9 years and I haven't had you here. Well, you've only been here for 7, but stick around. We got one more half to go. It's halftime. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I've got Pam Foster, VP of Care Coordination for Honor Health, in the studio with me. We're in our second half, and if you missed our first half, go up to our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You'll catch this first half and about 500 others we've been bringing to you for the last 9 years. So when we left off in the second segment, we were talking about the fact that, the services that are provided, who pays for them. And one of the things I was mentioning to our listeners is there's often times where, we as a partner of Honor Health go into the home and the home's not the safest place for the person to discharge. So where do they go to next? And Pam and I, we were talking during the break, literally in-home care providers like ours disappoint at least half of our callers because they think Medicare pays for their services. And unfortunately, at this point in time, CMS does not. Now, I do want to say a caveat. April April 2018, CMS put out an edict that Medicare Advantage would start paying for in-home care services. And that is true. There's about 20% of the Medicare Advantage companies that do, but they limit the hours. The hours are 40, 60. I've seen maybe as much as 100 hours per member per year. So that's a good plan for transitionary care, just not ongoing care. So, I know that there are other options too, Pam, and, the question always comes back, how do we afford these? So if you wouldn't mind, share with us, especially in the home. I think I've described that, but what are some of the other alternatives that people should be considering?
That's right, Bob. So sometimes when patients are leaving the hospital, it isn't safe for them to go home, at least at that point in time. And our goal is to work toward that. So, that's when we work with our physical therapy partners and occupational therapy to really put together a program so that the patient can regain their prior level of function, so that they are safe, so that they, we worry about falls in the home and things like that.
Yeah.
So we want to make sure that the patient's safety is number one. And so sometimes patients do have to transition to some type of what we call a skilled nursing setting before they ultimately go home. And sometimes patients can there's also acute rehabilitation centers. So there's different types of post-discharge settings. And typically when somebody has what we call a skilled need, so either they have a skilled nursing need or a skilled therapy need, those services in a facility like that are covered by Medicare for a limited number of days. But, if you have a traditional Medicare policy, you have, traditional Medicare with a supplement, typically those services are covered for, it's a little bit of a misnomer. People think they have 100 days. It's up to 100 days as long as the skilled need is there. And so when a patient goes to a facility, the team, just like in the hospital, they're constantly assessing the patient's needs to see if they're still going to qualify under that criteria, or if we're going to have to transition to back to home or to more of what we call a custodial or a private pay type situation. Sometimes patients can, sometimes if it's going to be more permanent basis, that where, someone is maybe living alone and we're worried about them really going back,
Right.
and, maybe they can't live alone, then in those types of situations, we look for more of assisted living type settings. And so there's a lot of those here in the Phoenix area. And, when a patient is in the hospital, we typically work with family or we work with placement agencies to sort of help coordinate that type of a transition. One of the confusing things, though, I think for anybody really is to understand, what type of care is covered, what's not covered. And so it's really important, I think, for the listeners to know that, when you have what's called a skilled need, those types of services typically are covered by Medicare and Medicare Advantage and commercial and other types of payers. But when the need is really ongoing and, the person gets to a point where either, their needs are just sort of, like if a patient needs help bathing or dressing or those types of activities of daily living, grooming, those kinds of services typically are not covered by Medicare. And some of the Medicare Advantage plans, to your point earlier, Bob, they do cover some hours
Right.
in that type of a situation. But if those are really going to be long-term needs, then they're typically not covered by the payer. Now, some patients and residents have what we call long-term care policies. And so, if you've purchased a long-term care policy, that's when you want to look at activating that. And so, we, the case managers, we often work with families that have those types of policies to figure out how do we activate that, how do we start getting those in gear so that coverage, because that's what you've purchased and it's
Right.
for that rainy day when you need it. So that's when you want to think about using that. When we look at care in the home, it's sort of the same rule of thumb. It's that skilled need, a skilled nursing need or a skilled therapy need. So when you need a physical therapist or an occupational therapist to come in and work with you because you have, something that we think is going to improve, it's more of an acute situation. Those types of services typically are covered by the payer. And then, it's the more, it's the housekeeping and meal preparation and transportation. Those things are often not covered. And so, when someone someone is experiencing a need, a time when we have to talk about that, that's when the case manager or the transitional case manager can help the patient to sort of look in the situation in total, and say what is going to be needed and help you determine, what kind of coverage you have and how long that's going to kick in and, what's available. Now, if somebody's going to have long-term needs that are ongoing and really, finances are a concern or they're really worried about the ability to pay for that. There are programs through the state of Arizona, long-term care that we can look at as well. And so we can help, determine, is this the right time to apply? Is this the right time? Should we think about that? And, again, one of the misnomers around that is that, people think that, the state will take my house, or, we hear all kinds of things that people are afraid of. And that actually is not the case. So we can work with you. We can connect you with an elder law attorney to help, determine your situation. And, if you're a married couple, there's a lot of options for asset protection and things like that. So we want to help work through all of that with the patient to determine, what those long-term steps look like.
We talked about a lot of moving parts, and that alone has a lot of moving parts.
It sure does.
And, I had a guest on, a couple weeks ago really talking about long-term care planning. And there was that misnomer that, especially with couples, that you'd have to get divorced. And she said, no, that's the last thing we want to do. We can still protect the assets,
yes, and
not have to have you be faced with a divorce. No. So it really isn't that bad.
No, it's not. And that's why it's really important to, if someone is struggling, with their health needs or struggling to take care of themselves or to keep up with things at home, or, if you're having trouble managing, it's really important to talk with your doctor about that, because, at your primary care office, they can connect you with the right resources, with case managers, with social workers to help you to really talk through the situation and figure out what the next best steps are to help make sure that you can stay at home and be happy and healthy and safe. And that's what we all want.
And we're talking a lot about our Arizona Long-Term Care Service offerings, if you would, through Access. I mean, there's just a lot of stuff that is out there available. Yes. But the other thing is VA benefits too.
And VA,
we have a lot of veterans that live here, and they don't realize that there's some aid and attendance programs. There's other programs that are available to help those veterans to be able to pay for those types
Housing,
of services.
Yep, absolutely.
And we'll use Noodles as an example. So my dad, Noodles, who was just discharged on Saturday. Today he's got visiting in his home. He's got a home health care company. He's got an occupational therapist that's going to be there today, and I think tomorrow, or is it Thursday, might be a physical therapist. So, those are the things that can be delivered right into the home. Or as you said, you can discharge into a skilled nursing facility and get a lot of those therapies, if you will, and then graduate and discharge into them.
That's right.
Pam, it's three segments down. I know, they go by really fast. So I want to talk, in terms of advanced planning, I want to talk in the fourth segment. I want to talk a little bit about advanced planning and what you have to say about advanced directives. I want to talk a little bit about COVID and what it's experienced. And then, if we have time, I want to talk about the future of healthcare and where you see it going. Okay. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Pam Foster here in the studio with me. She's the VP of Care Coordination of Honor Health. Stick around. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I've got Pam Foster here in the studio. She's the Vice President of Care Coordination for Honor Health. And if you missed the first three segments, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch this show and many, many more. So Pam, this is our last segment. So I want to see how much we can cover before we run out of time, and I probably will want to bring you back. So there's so much to cover.
Love to, Bob.
You have such a great responsibility within an incredible organization, and like I've said so many times, there's so many different moving parts, and we talked about in the last segment about the different ways to pay for services, and talked about the need for planning, right? Advanced directives, and how important is that, especially for those that show up in your hospitals?
Yes, and I can't stress enough the importance of advanced directives. And if there was one thing I could impress upon everyone who's listening today, it's to get those advanced directives done and make sure that you have them, make sure that they're current. And when I say advanced directives, what I mean is a medical power of attorney and a living will. And so quickly, what those documents are, basically a medical power of attorney appoints someone to help make medical decisions in the event that you can't. And so if I were to become incapacitated and not able to make decisions for myself, who would I want to do that? And so that's a really important question that everyone needs to ask themselves. And it, needs to be someone you trust. And sometimes, we see people that, they know that their children would have a really hard time making a difficult decision for them, or would have a really hard time following their wishes, and so they appoint a friend, and that's okay. It's anybody that you trust to make decisions, and it's important that you have those conversations with your family while you're healthy and while you don't have the need to activate those documents. But it's really important that your family know your wishes, or your loved ones, whatever support system you have, they know your wishes, and that they're willing to follow what you want. A living will is a document that, again, if you are incapacitated and can't speak for yourself, it tells us as healthcare providers what you would want, in the event that you were in some type of a terminal or vegetative state. So, would you want to be kept on artificial life support? Would you want artificial feeding? Those kinds of questions are addressed in that document. And that is so helpful to us because it gives us a roadmap for your care. And so, I really, you can find those documents on the Honor Health website. You can come into the hospital, primary care. There's a lot of places to get those. Your attorney, if you have, an attorney, a trust, lots of places to get those documents. But we really would like to have a copy on file so that, in the event we need to use them, we have them.
The Arizona Attorney General's office, as well as Secretary of State's office, you can find them pretty much anywhere. And I have to tell you, I think I may have shared this with you, Pam. Almost 2 years ago, I was a patient at Honor Health, and I'd been a patient prior to that. I had a tonsillectomy, and I had my uvula removed, and I had a septoplasty, literally 3.5 years ago, and I had my advanced directives in there. And so when I went in unexpectedly for a kidney issue, they were all there. So they had them. They asked me if they needed to be updated. I said, no, they don't need to be updated. Everything is there and in order. And just so our listeners know, you're giving your family member a gift. It is a gift because you have told them what your wishes are, and we're asking you to follow that with those wishes. And I also want to leave with this, those listeners that have children that are 18 or older, you don't have to be old to have advanced directives.
No.
And, just because they're your child, and, let's say your child is 19 or 20 and, God forbid, a million times over has an automobile accident, ends up in a hospital. Without those, you do not have the rights that you think you might just because you're a blood relative. So important to have those documents in order.
Very important.
Very important. COVID. It doesn't seem to be going away. But you know what? Right. But not only do we have vaccines, we have treatments, which is, the Paxlovid, and we have the monoclonal antibodies. We have ways to treat it, which is really nice. But, things have dampened down a little bit, have they?
A little bit, yes, a little bit. The virus is changing, and so we are seeing flares. They're not, I think what we're seeing right now is not as severe as what the first iteration of the virus looked like and the impact, but it's still there, and it still can make people very sick, and we're still seeing some hospitalizations. So it's really important to take precautions and be aware. But it's been rough, Bob. It's been certainly obviously devastating for our nation and for the world, and for our hospital system. But we worked very diligently and thoughtfully, our executive team and our leaders and all the way, our nurses, everyone in our health system worked together, I think, to, provide the best care we could to the community and respond as the needs changed. And we were just, working as a team every day. We worked as a system to leverage resources. And I think, we were able to meet the needs of the community. We were able to meet the needs of our state. We took a lot of patients from northern Arizona, provided services to patients, from rural areas in Arizona. So it was, as hard as it was a privilege to work, to stand up and, just meet the call of duty. And, I think it's something that anybody who worked through it will never forget. And we continue to face the challenge, but, we learn more about it all the time. And I think, it's different today than it was in 2020, but, it's, still.
You guys had national recognition on the way you set up the vaccinations.
Mm-hmm.
Amazing.
Mm-hmm.
I mean, really amazing.
Thank you.
I mean, it really was a team effort. I know that you practiced it. And then when the vaccines became available, I mean, it wasn't perfect, but it was pretty darn close. One of the things that Todd Laporte shared with us was, especially when the older adults were going through the line, he said we didn't realize we needed more porta potties because older adults, had a little more frequency. So he said we were literally, no pun intended, Johnny on the spot. We got new ones and we put them up there, so the older adults that needed to use them, they had them. But there are also so many things that happen. I mean, healthcare is so slow to adopt tech, and because of COVID, I think all of a sudden we went light years ahead.
We did.
And for the better. Mm-hmm. For the better. Yes. I mean, telehealth is just one of them, but there's so many other things that have happened as a result of it that I think, if there's a silver lining, and we moved healthcare a little bit faster forward, which we needed to.
Yes, we did. And I think we saw how resilient we could be. We've learned how to leverage technology. So, we've seen things like hospital at home programs and remote patient monitoring programs emerge through this pandemic.
Sure.
And some of the restrictions that we've experienced for many years, were lifted, and I think we're looking at permanent changes in some of the old Medicare laws that really make it easier for us to deliver the best care we can.
And it's beneficial. Like, telehealth is so beneficial for someone that is like 80 or 90 or 100 years old and just needs to not physically be touched by a physician, but it's a check-in to see how the medications are going. Maybe it's an anticoagulant visit that you need to have. Gosh, there's so much more I want to talk to you about. This one piece. I want to talk to you about the future of healthcare, and we didn't get to it. We really didn't.
Well, I'd love to come back, Bob, anytime.
Pam Foster, it's so good to see you, and thank you for donning our studio and sharing with our listeners all these things that Honor Health is doing here in our community. And there's so much more that we can get to if we get you back here in the studio.
Thank you, Bob. It's been a real pleasure to be here with you today.
Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.